Good evening, sir. Shall I start, sir?
Hmm.
Mm.
Yeah.
My topic is I'm going to present about hospice care. Hospice care and palliative care, though both sound similar, there is some difference between them. Palliative care is appropriate at any stage of serious illness. Hospice care is
is a word arrived from a French word. Its origin is from French word. Means take care. That is all the meaning of the word hospice. Okay? And
Okay.
it can be done not only in the hospital. It can be done at home. It can be done in a special institution sent for that, or it can be a part of the hospital. And another important point you remember, you have to write in your exam theory as it is a multidisciplinary function. It is not a single person who can do hospice treatment for the patient. It is a multidisciplinary team which will involve the physician, the nurses, the paramedical people, because you need so many people who are, supposing a patient is bedridden and he has to be given a bath, he has to be dressed up, he has to be fed. It cannot be done by a single doctor or a nurse or a paramedical person. So you need a whole team, and you need a social worker, you need a caregiver, you need a spiritual person to come and talk to the patient to cheer them up. So it is a multi-speciality team, and it is something like doing a great service to a dying person. That is the ultimate aim of a hospice. Okay, so that is, with that I just share my PPT for you. It's a very short presentation, and is it visible?
Yes, sir.
So the question that has been asked in the for you is, what is hospice? When should you begin hospice care? How does hospice serve patients and families? This was the question in 2012 or something. So hospice is a type of healthcare. It's nothing but a branch of healthcare that focuses on palliation. That is, palliation means just taking care. It is not a cure, but it is a control of the disease process to some extent of a terminally ill patients. The patients who usually they all suffer from severe pain and symptoms, and attending to their emotional and spiritual needs at the fag end of their life. So you know that they are going to die within 6 months' time, and you want to make them live as comfortably as possible. We cannot, of course, guarantee 100% complete freedom from all these problems, but to the maximum extent, one can try and make them comfortable. So the goal of hospice care is to prioritize comfort, quality of life, and individual wishes. Whatever wishes, supposing an old man, he says, I would like to see my grandson, or I would like to see my daughter, then those wishes should be somehow managed to be fulfilled. That is also a part of the hospice. So it prioritizes, gives importance to, first of all, the comfort of the patient, the quality of life, and individual wishes. So it is from the French word hospice, which is refers to institution where sick and destitute people are cared for. So it is nothing but taking care. That is the meaning primarily, and may not all the time have a palliative connotation also. And hospice do not perform treatment. This is a very, very important thing. It is not going to patients who are in the hospice places like the hospital or a home or hospice areas. They will not be having any chemo. They will not be having any radiation to cure the disease or to aim to reduce the disease. They are in their ultimate final stages, so no treatment will be as such performed, or no diagnostic or other investigations also will not be done. At the same time, they do not do anything to hasten the death of the patient. So in the Miller, it is nicely given. There's a difference between omission and commission. Okay, when you say omit, for example, if you don't give a particular drug which will prolong the life, it becomes an omission. But if you give a drug which will hasten the death, for example, if you keep on dumping a terminally ill patient with severe pain with excess dosage of morphine, it may produce respiratory depression and kill the patient. So there is a difference between omission and commission. In omission, you just withdraw the treatment drug like chemo or radiation and allow the disease process, which is already in a far advanced stage, to progress. That is called omission. Whereas if you give a treatment which is going to harm or worsen some physiological activity and hasten death, that is called commission. So in hospice, they don't do any commission. They don't give excess morphine. They don't give any. Then it also becomes euthanasia or physician-assisted killing. Something like that it will happen. So this is not the idea of hospice. It is just to make the patient comfortable to the extent possible without harming them, at the same time without prolonging the life. So this is the small confusion that you should have a very clear concept. In hospice, there is no proper treatment advocated. If a patient is selected for hospice treatment, you don't advocate any surgery or any chemo or any radiation. On the contrary, you keep them comfortable with a painkiller or with a sedative to the extent of prescription which can be tolerated by the patient, and not giving them too much of a drug. And hospice focuses on palliative care mainly to relieve pain symptoms, not curative procedures, as I told you earlier. Compared to general health care, this is the difference. In general health care, hospice professionals, that is the people dealing with the patients, have a different approach to talking to the patient and their families. Whereas in general, for this is the example. For example, there are more likely to make predictions or express uncertainty around future events. For example, he might die this week, or I think she might live longer. This is how the hospice worker healthcare providers will talk. Whereas a regular treatment provider, a healthcare provider, will talk like she needs a nurse, she can't go home now. So this is how it will be issue orders or prescribe action. So their conversation or their talk with the people and family will be slightly different in hospice, which will have more of a prediction and express uncertainty, whereas those who are in the treatment line of healthcare will issue orders and prescribe actions. So these are the examples that are given to make you understand that. And hospice can be provided in assisted living families. Where hospice can be given? That is one of the questions. What is hospice? When should it begin? How does hospice serve the patients and families? It can be provided in assisted living facilities. It can be done in nursing home, or it can be done in group homes and within a hospital setting itself. So all these areas can provide hospice treatment. And an interdisciplinary approach is used to deliver medical, nursing, social, psychological, emotional, and spiritual services through a collaboration of professionals and other caregivers. So that is why I told you this point has to be emphasized in your answer. It is an interdisciplinary approach which involves all of these people. Then when a patient chooses a hospice care, care is specifically tailored to address issues related to the terminal illness. Okay? And the patient should agree to forego curative treatments. This should be documented and taken in the consent should be taken for this. That is, no more chemo, no more radiation, no more surgery, or no more newer drug experimentation. So patient should be clearly explained about this, and you must get a consent for them to forego any curative treatment which may be tried in some other conditions. And services are covered by the Medicare hospice benefit. Sometimes they have a medical insurance also, so that the cost or the uh, financial part should not be a deterrent to a patient getting a hospice care. All end of life concerns are addressed in a holistic manner in hospice, and patients receive skilled palliative care interventions to ensure comfort. And so this is the difference, as I asked you earlier, about the hospice care and palliative care. In hospice, a type of care for terminally ill patients and dying patients. The maximum life will be only 6 months. That is given in the last sentence here. Life expectancy of patients in hospice is maximum 6 months or less. Whereas in palliative care, it's a type of care aimed at promoting comfort for seriously ill patients, whether their condition is terminal or not. Whatever be the condition, you have to take care. That is palliative care. The second thing is bereavement services are provided for up to 1 year after death of the patient. So this is the most important difference between the hospice and the palliative. So post-death bereavement services are provided in hospice. These are not always provided in palliative care. And in hospice, the care is primarily delivered at the patient's home or other areas. As I told you, if patients cannot come to a hospital or a center, it can be delivered at home also. And care may be delivered in acute care, long-term care homes, and other settings. So somewhat slightly similar things between these two. And patient chooses to forego curative treatment in hospice, whereas in palliative care, it is not. Patient is provided in conjunction with either curative or end-of-life treatment. Both can be provided in palliative care. And hospice is covered by medical benefit, whereas palliative care may or may not be covered by Medicare or other insurance plan. And as I told earlier, life expectancy is only 6 months or less in hospice, whereas life expectancy is not a factor. Here you try to cure as well as keep the patient comfortable in palliative care. It is always aimed at one day or other this patient may come out of this cancer or this long-term illness and come back to normalcy. So that is the aim with which you treat a patient in palliative care. Whereas in hospice care, you don't include any curative treatment because the patient is destined to die. So I'm showing a few pictures to make you understand much more easily what is the old and new approach. In the old approach, life prolonging care till the patient dies. Okay. So if you diagnose a terminally ill cancer patient, then you keep on giving whatever curative or palliative treatment that is possible and prolong the life as much as possible. That was the old concept. So the disease goes on progressing and patient suffers with the pain or whatever discomfort and goes on living with that and ultimately dies. Whereas in the new concept, after hospice has been becoming part of the terminally ill patient's treatment, now if the patient, once you first diagnose the serious illness at this point, and if the patient responds to the treatment, life prolonging care goes on, patient completely recovers. On the contrary, at the time of diagnosis itself, it has become grade 3, stage 3 or stage 4 cancer or other illness, then you start the palliative care because you know that you are not going to completely cure the patient and get him rid of that problem. So you start palliative care at this stage itself and then go on to decide whether it will be stopping at palliative or go on to become hospice where there is no chance. And in the hospice, it includes the bereavement, that is post-death. Here death happens and hospice extends even beyond the death. So that is the difference between palliative care and health care. I hope this picture gives you a good idea. And again, another picture to show patient is very healthy here in this stage. The diagnosis of a very incurable terminal illness is made here. Then the patient suffers from the illness. And here all the curative steps are taken. Patient completely recovers because the disease gradually, which was diagnosed, becomes narrow and the patient recovers. On the contrary, the curative care is not helpful. Then he goes for palliative focus on quality of life, no curative therapies, then end of life care, dying, then bereavement. So this becomes hospice care. That is the last terminal stages plus the post-death care is included in hospice care. I hope I am very clear and able to impress this point on you. And the continuum of palliative care, again, this picture shows what are the things that are able to do. And symptoms are disease, distress, discomfort, and dysfunction. These are the four things that 4 Ds you can remember: the disease process, the distress that it produces, the discomfort, and the dysfunction. So a patient is not able to function properly, so that gives you the various things for that. And the hospice care becomes a part of the palliative care. You can see this is the big circle: symptoms, management of chronic and life-limiting illness, hospice care, comfort care at the end of life, plus the post-death care. So this is these 4 pictures, I think, will be able to give you a clear concept about hospice and how it is to be done. I'll stop that there. You have any doubts? Any questions to ask? Any clarifications? Jemima, is it clear now?
Yes, sir. Yes, sir. Thank you,
Okay.
sir.
Thank you very much. Like, if you have no questions, then we go